everyone, welcome to the first class of our 90-day medical coding journey. I am Dr. Tania and I will be your guide as we go step by step from the beginner to CPC exam. Even if you have zero prior knowledge, this course is designed to make the coding simple and exam focused. So let's begin our class. So first, let's know what is medical coding. What is medical coding? It is convert doctor notes to codes used for billing and reimbursement and ensures accurate medical record. So in short, medical coding is the process of converting the medical documentation like doctor notes, diagnosis, procedures into standard codes. These codes are used by hospitals and insurance companies for billing and reimbursement. Think of it as translating the medical language into code language. Without coders, the claims can be denied and records can be incomplete. So, which are the types of the medical code? The major types are ICD-10-CM. So, it is the international classification of the disease dealing with the diagnosis of the disease. CPT is the current procedural terminology. And most of the procedure we come across in the medical field. HCPCS are dealing with the supplies or equipment. For example, the wheelchair, ambulance, X-ray machine, like that. Who can learn medical coding? The students, nurses, pharmacy students, life science graduate, professional, all can learn the medical coding. So medical coding is for anyone who wants a healthcare career, even without a medical degree. So ideal learners include the fresh graduate, nurses or paramedical staff, pharmacy student, simply anyone looking for a stable work from home healthcare career. If you can study consistently, you can become a certified coder. What is CPC? What is the full form? It is Certified Professional Coder. CPC stands for the Certified Professional Coder conducted by AAPC, and it is one of the most recognized certifications in the medical coding field. CPC certification proves that you can code accurately, efficiently, and ethically, making you highly employable. And the overview. There are 100 multiple choice questions, 4-hour duration, open book exam, and passing score is 70%. So the CPC exam has 100 MCQ, that is a multiple choice questions. And you have 4 hours to complete it. And it is an open book exam. Open book means you can take your book and you can find the answer from your book itself. But don't be fooled. Time management and clear concepts are critical. A good strategy and practice are key to passing. So even you have the book, you should know how to use it. Also, the time management is very crucial in the medical coding examination. Why a 90-day plan? Why we plan a 90-day? So month 1 is basics plus ICD-10. Month 2 CPT plus modifier, and month 3 we practice with exam strategy. Many beginners struggle because they don't know where to start. ICD-10 can feel confusing and CPT can seem overwhelming. That's why I have created a structured 90-day plan. Month 1, I told we deal with the basics, anatomy, terminology, ICD-10, etc. Month 2, we can go with the CPT, modifiers, HCPCS. Month 3, practice questions, mock test and exam strategy. We will take it step by step to make coding simple and achievable. How to use this course? Watch classes in order, practice the coding daily, revise guideline, join the community. So to get the best result, don't forget to watch the classes in sequence. Practice the coding using a code book while watching. So when I am taking the class, please go through the coding book. Revise regularly. The guidelines are very important. Comment or ask question if you are stuck. So if you have any doubt, don't hesitate to ask the question. Also, you can comment on the comment section. Following this routine will give you confidence and speed. which is essential for the exam. Now, what are the career benefits for the CPC coder? Medical coding is not just about passing exam. A career in coding can give you stable income, remote work opportunities, high demand in hospitals, clinics, insurance company, growth in auditing, compliance, or teaching role. It's a career that combines healthcare knowledge with flexibility and security. Our next class will be ICD-10 CM. So in the next class, we will start with the ICD-10 CM, which is the foundation of the diagnosis coding. If you are serious about this journey, subscribe the channel, hit the bell icon for notifications. Also, don't forget to like this video. Comment CPC day 1 to show you are starting the journey. So, let's start the journey. Thank you.